Multiple rural healthcare clinics in Virginia are having to shut down because of Donald Trump's big, beautiful bill. And the worst part is the Republican elected officials in Virginia are absolutely silent about this. Augusta Medical Group said it's closing 2 primary care clinics as well as an urgent care center as an ongoing response to the One Big Beautiful Bill Act and the resulting realities for the healthcare delivery. Jenna Chrysler is a Democratic candidate running for House of Delegates in a district that includes a large amount of Augusta County. She also works as a physician, and one of these clinics that are closing is only 5 miles from her house. Here's what she had to say. If you have the closing of those 3 clinics, you will have an increased demand on the remaining clinics, which are all at least 10 miles away or slightly more, which is 15 to 20 minutes of a country road. Of course, this major increase in the time these people are going to have to take to get to a hospital could result in them passing away. But I guarantee Donald Trump and all of the billionaires who are getting a massive tax cut don't care about that. Here's another powerful quote. There's a saying in the Valley, if you can survive it, go to Augusta because they will give you the best health care possible. She went on to say to have that care limited because of Republicans and Trump's big, beautiful bill is truly devastating. The worst part is we are just now starting to see the impacts. A report published in June found that 338 rural hospitals nationwide would be at risk of closing due to Trump's bill. It's not even hyperbolic to say that millions of Americans are going to have their lives at risk because of Donald Trump's policies. Not only is he taking away their health care and making it much more expensive for them to be seen by a doctor, but he's also taking away the hospitals.
2025, Trump's Medicaid cuts are tearing into rural America's healthcare system. Let's take Kentucky as an example. At the start of this year, more than 24 hospitals across the state still had maternity wards, but by September 2025, that number has been cut in half. Only about 12 hospitals are still delivering babies. That means mothers in small towns are now driving 60, 70, maybe sometimes even 80 miles just to give birth. And it's not just Kentucky. Across the country, rural hospitals are hanging by a thread. Medicaid cuts hit them the hardest because Medicaid is often the largest payer in rural communities. All right, now, when that money disappears, hospitals can't keep their ERs, ICUs, or maternity wards open. In August 2025, the American Hospital Association warned that hundreds of small hospitals could close within 2 years if these cuts continue. Already, dozens have reduced services or shut down entire departments this year alone. And for mothers in rural America, it can be the difference between life and death. The U.S. already has one of the highest maternal death rates among developed nations.
With the loss of Medicaid and the closure of rural hospitals, the number one thing I hear is have the day you voted for, or you deserve everything that's coming to you because you live in a red state. Let me introduce you to my son, Alex. Please tell me why he deserves to die because he lives by a rural hospital. Also, let me introduce you to his friends. Why do they deserve to die? Because they live near a rural hospital. Did you know that 35% of us did not vote for him? We voted for her. So what do we deserve? My friend Will was in a horrific farming accident when he was 10 years old. Will almost bled to death. He needed to be closer to health care, but was able to get to a large hospital. Now the hospital near him is getting ready to close. Almost everybody in America takes vacations in rural areas. May it be canoeing on the Current River, canoeing on the Buffalo River, visiting Yellowstone, and getting ran over by a bison. Do you deserve to die because those rural hospitals are closed? Because that's what you're saying to all of us. We deserve it.
Kentucky's about to lose 35 rural hospitals because Congress cut Medicaid. The president signed it, and now they're hoping we don't notice what happens next. But I noticed your hospital might be on that list. Pineville, Berea, McDowell, Barberville, places that already don't have enough. What happens when the ER shuts down? What happens when a mom in labor has to drive 2 hours? What happens when there's nowhere to go for mental health care? This isn't bad luck. This is a decision, and we can still fight it. We can call our reps. We can demand a plan from the governor. We can make sure this isn't ignored. So yeah, share this post and then raise some hell.
This time last year, the residents of Unicoi County, Tennessee were still proud of their 4-year-old hospital, Unicoi County Hospital, which had been built by Ballad Health in 2018. And then Hurricane Helene hit. And 2 days after it made landfall, 54 staff and residents of the hospital, including about a dozen rescue staff that had come on fast boats, had to be airlifted via helicopter from the roof of the hospital. And the hospital is yet to rebuild. The estimated cost to rebuild it is now in excess of $50 million. And FEMA and the state of Tennessee have contributed about $9 million. But thanks to the massive Trump bill that just passed, well, it now looks like the hospital won't be rebuilt, leaving Unicoi County residents without a hospital. And Ballad Health, that operates more than 30 rural hospitals through Tennessee, North Carolina, and Virginia, is now saying by the end of 2028, they'll likely be losing $125 million a year, where they had just begun to operate in a $30 million a year operating profit that they were turning towards opening more hospitals in rural communities. Thanks to the Trump mega bill, more rural hospitals are going to continue to close, and this story is going to be repeated around the nation, particularly in red rural states.
Gavin Newsom is calling out Donald Trump for betraying rural hospitals and communities that overwhelmingly voted for Trump. He posted this article here saying another California county is losing its only hospital after feds refuse to step in. And he says, heartbreaking, Trump continues to betray rural Americans, this time closing the one and only hospital in a county that he won by nearly 2/3. Since this hospital is closing, people that are having issues in this town will now have to drive 40 minutes into a neighboring county for critical care. Additionally, 150 healthcare workers are going to lose their jobs because of this, already resigning and seeking work elsewhere. The federal government is taking away this hospital's critical access designation, which is 40% of its overall revenue, a gap too large for them to fill, forcing them to close down. And get this, it's all happening because of a newly interpreted federal rule. It requires critical access hospitals to be at least 35 miles from the next closest hospital when traveling by main roads. I mean, how ridiculous is that? This hospital is only 32 miles away, so it's 3 miles short of the required distance. But they're arguing they don't take that route to get to the hospital anyway. They take a different route which would meet that standard. However, of course, the federal government under Trump doesn't care, and they're still taking away their funding and forcing this hospital to close down. But I hope Republicans in rural areas see this video and understand what Donald Trump's priorities are. He's doing this to these rural hospitals so he can give billionaires more money.
Children's Hospital Los Angeles just laid off 437 employees. That includes bedside staff, therapists, case managers, and other non-clinical roles across almost every department. The layoffs go into effect October 28th, and CHLA says staff will still receive pay, benefits, and severance in the meantime. But here's what's not being said directly. CHLA leadership blamed growing financial challenges, but didn't exactly specify what those challenges are. And so here's the context. Their Sabin Research Institute is among the top 10 pediatric research centers funded by the NIH. But since Trump was reelected, NIH budgets have faced serious political pressure. At the same time, this administration also signed the One Big Beautiful Bill Act on July 4th, which includes hundreds of billions of dollars in Medicaid cuts. A pediatric critical care physician who wrote in Stat News already warned that this law could devastate children's hospitals. CHLA hasn't confirmed if that's the reason behind these layoffs, but the timeline and impact speak volumes. So they have now frozen hiring, canceled job openings, and started cutting back on hospital supply purchases. And yet they're still telling the public children continue to need the specialized care only CHLA can provide. But let's be clear, you can't cut that many positions, 450, and still promise the same level of care. Not for NICU babies, not for kids in oncology, not for children recovering from surgery. So this is one of the most elite pediatric hospitals on the West Coast. And even they are not protected from what's happening nationwide. It's Medicaid, it's research funding, it's broken reimbursement. And above everything else, it's the kids and the frontline staff who keep getting left behind.
It isn't often that right-wing accounts surprise me, but this one made me sick. So recently, the Augusta Medical Group announced that it was closing 3 rural health clinics, and it's left that community reeling, people wondering about how they're going to get care. It's a whole mess. And the reason that they're closing those clinics is because of Trump's one big beautiful bill that Republicans have supported that's taking away lots of money from Medicaid. It's going to raise insurance premiums for the Affordable Care Act insurance. And so it's left people scrambling, and this is happening all over the country. But there are right-wing accounts here in Virginia saying that the reason that those clinics are closing is because they had something to do with trans kids. And it just shows like the depravity of this logic, that they want to scapegoat this vulnerable population of people while rich people are getting tax breaks and lining their pockets because we're taking away healthcare from working class people. And so let's just be really clear. Let's draw a line under it. Rural healthcare clinics are closing because of Trump, because he's taking away the money that supports those clinics. We're going to be following the news of these Medicaid cuts and their impacts across the state. So if you want to keep up with that story, follow us at Dogwood.
Trump signed that big, beautiful bill, and hospitals in Virginia are closing. But see, when I said that, everybody was like, no, ain't no hospitals gonna close. Girl, you don't know what you're talking about. It's not gonna touch the health care. It's not gonna touch the Medicaid, Medicare. Remember, that's what I said, and that's what y'all said. But see, now, the hospitals are closing. And they're gonna continue to close, especially in urban areas. So if you're smart, you would get out of those poor states like Louisiana. Like my family is from Rayville, Louisiana. And that little hospital in that town is going to close. It's gonna go bye-bye. Yeah. And I keep telling y'all that. And y'all don't ever want to believe me. And that's okay. You don't have to believe me. You're gonna see it. So if you're smart, you would get the hell out of those little bitty towns and go find you somewhere else to live. I hate to say it, but find some nice little white areas. They get taken care of the best. You don't want to hear that, but it's true.
Oh my God, I'm an algorithm howl. Please interact with this video if you appreciate my content. Did you guys see what just happened out in Nebraska with that one rural community hospital that announced it's going to be shutting down specifically because of Medicaid? Well, a bunch of journalists went out there to interview the residents. They're all MAGA. And let me tell you, they don't believe it. They think the hospital is lying, that people are looking for a reason to blame Donald Trump. They're saying these Medicaid cuts don't even kick in for another 2 years. It's all lies, 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 and they're angry at the liars who want to take down Donald Trump. They're blaming it on greed. Listen, I know that they don't teach this kind of stuff in public schools. But when it comes to hospital budgets, which are complex, they're enormous. You need multiple accountants to take care of it. They do what's called short-term budgeting, which is 1 to 5 years in advance. That includes anticipating what's going to happen 2 years from now when these Medicaid cuts kick in. And then they do long-term budgets, 5 to 10 years in advance. They got to know where the money's going to be coming from, what their expenses are, and can they afford to keep the hospital open. So they know that that tax has been gutted in this big, beautiful bill. That service provider tax, where the federal government matched a certain amount, and that's what kept these rural hospitals open, that has been gutted. So they know they're not getting that money anymore. Further, they know that the majority of their patients are on Medicaid, and that a ton of them are going to be losing their Medicaid. So what's going to happen? They need to go to the emergency room because they're really sick. This hospital is going to treat them because they won't turn them away. The hospital is going to go under very fast when you put all of these Medicaid cuts all together, forecasting up to 5 and then up to 10 years ahead of time. They will not blame Trump and the Republicans for this. Let me tell you, I agree with them about